Mhm. Come on, I don't. The right local foods doesn't just fill your child's tummy, it builds their brain, boosting learning, memory, and mood. Today on Brainwaves, we are serving up the best nutrition for your child's brain to thrive. First up, healthy fats. Your child's brain is nearly 60% fat, and it needs the right kind of fat to build strong brain cells. Avocado pear, nuts and seeds, fatty fish like mackerel or salmon, eggs. These foods are rich in good fats, which are essential for focus, memory, and brain development. Next are the brain spark plug, iron, zinc, and choline. Iron from kontomire carries oxygen to the brain. Zinc from beans supports memory, and choline in eggs helps with learning. A lack of these can slow down brain power. For steady energy and protection, turn to complex carbohydrates and colorful vegetables and fruits. Foods like maize and sweet potatoes provide lasting energy, while fruits protect the brain cells and support a healthy mood without the crash from sugary snacks. You don't need a perfect diet, just progress. Try these easy tips. Add groundnut paste to soups and porridges. Swap sugary drinks for sobolo or water. Serve kontomire or other leafy greens regularly. And use palm fruit oil in cooking for healthy fats. Every healthy meal is an investment into your child's future. With our rich local foods, you have everything you need right here. What's your child's favorite local brain healthy food? Share below. Follow Brainwaves with Dr. Vida for more tips. Akwaba, Ghana. I'm Dr. Vida, a neurologist. Every day, I see the incredible power and vulnerability of the human brain. Your brain is not just part of your health, it is your health. It dictates your memory, movement, mood, your very essence. Why is it important right here and right now? Stroke is the leading cause of death and disability in Ghana. Dementia is rising, silently burdening families. Headaches, nerve pain, seizures are becoming common. Children's learning is deeply tied to brain development. Ignoring brain health is a risk to our future. That is why I'm launching Brainwaves with Dr. Vida, to show you how to protect your brain from strokes, dementias, and other threats before they strike. I'll teach you how to spot warning signs and seek early care, and replace fears, myths, and stigma with understanding and hope. Expect clear explanations grounded in evidence and my clinical experience. Your brain is Ghana's most precious resource. Subscribe now and let's build a healthier Ghana together. The right local foods doesn't just fill your child's tummy, it builds their brain, boosting learning, memory, and mood. Today on Brainwaves, we are serving up the best nutrition for your child's brain to thrive. First up, healthy fats. Your child's brain is nearly 60% fat, and it needs the right kind of fat to build strong brain cells. Avocado pear, nuts and seeds, fatty fish like mackerel or salmon, eggs. These foods are rich in good fats, which are essential for focus, memory, and brain development. Next are the brain spark plug: iron, zinc, and choline. Iron from kontomire carries oxygen to the brain. Zinc from beans supports memory, and choline in eggs helps with learning. A lack of these can slow down brain power. For steady energy and protection, turn to complex carbohydrates and colorful vegetables and fruits. Foods like maize and sweet potatoes provide lasting energy, while fruits protect the brain cells and support a healthy mood without the crash from sugary snacks. You don't need a perfect diet, just progress. Try these easy tips. Add groundnut paste to soups and porridges. Swap sugary drinks for sobolo or water. Serve kontomire or other leafy greens regularly. And use palm fruit oil in cooking for healthy fats. Every healthy meal is an investment into your child's future. With our rich local foods, you have everything you need right here. What's your child's favorite local brain healthy food? Share below. Follow Brainwaves with Dr. Vida for more tips. Accra, Ghana, I'm Dr. Vida, a neurologist. Every day, I see the incredible power and vulnerability of the human brain. Your brain is not just part of your health, it is your health. It dictates your memory, movement, mood, your very essence. Why is it important right here and right now? Stroke is the leading cause of death and disability in Ghana. Dementia is rising, silently burdening families. Headaches, nerve pain, seizures are becoming common. Children's learning is deeply tied to brain development. Ignoring brain health is a risk to our future. That is why I'm launching Brainwaves with Dr. Vida, to show you how to protect your brain from strokes, dementias, and other threats before they strike. I'll teach you how to spot warning signs and seek early care, and replace fears, myths, and stigma with understanding and hope. Expect clear explanations grounded in evidence and my clinical experience. Your brain is Ghana's most precious resource. Subscribe now and let's build a healthier Ghana together. Hello, everyone. A very good day, good evening, good afternoon, good morning to wherever you are joining us from. Today is World Brain Day 2026, July 22nd. And the theme for this year is Brain Health Access to All. And the World Federation of Neurology dictates these themes. And this year, the message is simple. There is the urgent need for access to brain health. Delayed access is a potential access denied. And despite medical advances, access to neurological care remains fragmented. And so this life is an opportunity for a neurologist like myself to answer your burning questions you have on your brain health. And I have a list of questions with me here today that has been submitted by you. And so we'll start off with the questions. Accra, Ghana, I'm Dr. Vida, a neurologist. Every day, I see the incredible power and vulnerability of the human brain. Your brain. So we want this question and answer session to be interactive. So I would want you to put in your comments, questions whilst we have this live. So I'll move on to the very first question that was sent to me on headaches. Now, Aisha, let me read your question, Aisha. Aisha says, when is a headache just a headache? And when should I be worried that it could be something more serious? Now, the fact is, most headaches are not dangerous, but there are some signs that you have to look out for that will tell you this headache is dangerous. So, just a preview. When any structure around your head, from your muscles, your nerves, can be stretched, and then your brain interprets it as what? Headache. So headache has a lot of causes. But for you to know that is a dangerous one, these are the signs you have to look out for, Aisha. And I hope you are here to listen to it. A headache that comes on suddenly. You are there and you have a sudden headache, and it's so severe and it reaches its maximum intensity within minutes. If you were to grade the headache, between a scale of 1 to 10,
how intense the headache is. Within a minute or few minutes, the headache is able to get to a scale of 10 over 10. That is what we describe as a thunderclap form of headache. And most people describe it as the worst headache of their life. That kind of headache is a red flag, and you need to visit a doctor immediately. A headache that comes with stiff neck or a fever could be caused by meningitis. So when you have a headache and you have fever and your neck is very stiff, you need to see a doctor. That is a cause for concern. And then when the pattern of headache changes, so for example, you experience headache and you know how it feels when you get them, but all of a sudden this headache changes and you feel it differently and it's persistent, that is a red flag. So if the pattern of headache also changes, that is a red flag. And then when you have a headache after a head injury, you bump your head somewhere, you have a road traffic accident and you suddenly have a headache, even if it's a small headache, it could be a concussion. And so you need to visit the hospital to have it checked out. And a headache that comes with weakness and confusion or vision changes is a red flag. So Aisha, if you experience any of these red flags, that is when you should be concerned and visit the hospital. If this headache you're experiencing gets worse over time, is persistent, and when you do certain simple things like hydrating and resting, if it's still there, as intense as it is, I would advise you to have it checked out. But most headaches are harmless, but don't ignore the ones, as I said, that are different or have these signs. Let's move on to the next question. So Aisha, I hope I've answered your question. Now, Joy from Nigeria, thank you for your question. Joy says that I get headaches quite often. How can I tell whether they are caused by stress or whether I should seek medical attention? So I think headache is a very big issue. So I need to talk more about it. And this is a very important question. I hear it all the time. And most people come to the hospital because of this. They are worried that their everyday headache could be something more. Let's figure this out. Now, we need to understand headache from stress. So Joy's question is whether it's from stress or a headache that needs attention. Now, most stress headaches feel like a tight band around your head. So you feel the pain around, usually on both sides of your head. And usually it's mild to moderate and it will not be pounding. And most importantly, it will not stop you from doing your activities of daily living or how you function at home. And usually when it's from stress, a bit of rest and over-the-counter medications, few simple painkillers will go away. But if you're under a lot of stress and you are not sleeping well, and you feel this clenching feeling in your jaw, probably stress is causing that headache. Or if you feel some tightness in your neck, it could be from stress. So that is an important difference. The other thing is headaches, most, as I said, are harmless, but those headaches that come on suddenly, those are very important. You have to see a doctor about it. So if it's thunderclap, as I mentioned earlier, reaching its maximum intensity within minutes, 10 over 10, you grade the intensity of the headache 10 over 10. That is a red flag. It could signify something more serious in the brain. If you have a headache that is associated with vision changes, balance changes, weakness on one side of your body, it could be a stroke. And so you need to see a doctor. And any headache that wakes you up from sleep is also a headache that you should be concerned about. And they are very uncommon, but you need to investigate it. And a headache that gets worse over days and weeks. So I said a headache that is sudden in onset or begins suddenly has to be checked out. But a headache that also persists over days and weeks without relief, you need to see a doctor to check it out. But when we do have headaches, there are simple things we can do to relieve the headache. One is to drink water. Most of us do not know that we require 3 liters of water in a day or more. So drink a lot of water. Most people call me about headaches they experience in the afternoon. And when you ask them, they will tell you that they've not had any water up till 12 o'clock. That is bad. You need to stay hydrated because your brain is over 70%. It depends on water. So if you are not drinking enough water, you feel mentally stressed or mentally fatigued, and you need to rest and relax. Sometimes most headaches go away with just rest, finding a dark room and resting for about 20 minutes to 30 minutes, and the headache goes away. If you feel any tension in your neck, sometimes a warm cloth at the back of your neck or a cold cloth at the back of your neck can relieve the tension you have in your neck or sometimes on your forehead. And also, there are a lot of people who take in a lot of coffee or caffeine. It keeps you stimulated over the whole day. So if you are heavily stimulated throughout the day, you may not be able to sleep well, and you may be having the headaches from excessive caffeine or withdrawal from the caffeine when you stop abruptly. And then one of the things you have to check is posture. So one of the things that are very dangerous is posture. Now, posture from poor sitting. So whenever we sit, we are supposed to sit stretched with our neck, the spine, the cervical spine properly aligned. And most of us sit poorly. We are always on our phones, reading phones on our laptops, and we don't have our tablets or laptops on the eye level. So when you bend to look on your phone, you are stressing your muscles in the neck, and they can be the cause of your headache. So you always have to check your posture. But I'll tell Joy from Nigeria that if you have the headaches and they do not get better, or it's a different form of headache from what you experience, please check with your doctor. And sometimes the headache may be from your high blood pressure. Maybe if you have high blood pressure and you are not taking your medications and your pressure goes up, you can have headaches. And so it's very important to also check your blood pressure and be sure that your blood pressure is not high. Let me go to the next question. So as I said, if you have headaches and you have a change in your pattern of headaches, you have to check it out. The next question I'm reading from Nonto, Zimbabwe. Thank you for your question, Nonto. It's quite long, so I'll read it before I answer it. Now, Nonto says that my teenage son has been having recurrent headaches. Recently, he developed a severe headache that became much worse whenever he stood up or lifted his head. His blood tests were normal and hydrates often, but he was eventually diagnosed with migraine. So this is a teenage son. He was prescribed cocodamol and some paracetamol, but to no avail. One medication, Migral, helped temporarily, but the headaches returned after he completed the course. Should I be concerned? Can the teenager develop migraine? And does a family history of headaches increase the likelihood? All right, so I would put away the question and answer. Yes, absolutely. Migraines are common in teenagers, and sometimes teenagers experience migraine differently. Teenagers, usually an adult will complain about migraine on one side of the head. Teenagers will complain about it on both sides of the head. And then the pain can be severe, it will be throbbing, and often when they engage in any form of activity, it becomes worse. And that explains what your son is going through. Sometimes when they try to bend, or sometimes when they try to stand, or just lifting the head, they can experience what you described that your son is experiencing. Now, the only difference sometimes is that teenagers experience migraine in a shorter interval. Okay, and sometimes experience it in a worse form, as in sometimes it's associated with nausea, sensitivity to light. Adults too experience it, but sometimes it can be severe in the teenagers, and it can be severe enough to affect his learning or affect his normal activities of daily living or what he does in a day. So that is true. You asked about family history of migraines. Yes, family history is important. Yes, there's a strong link and a significant genetic component to migraine. So if a parent or a close relative has migraine, the likelihood of a child developing it is high. And if both parents have um, migraines, it's likely that that's the cause of your son's headache. I don't know if that for your family, but it doesn't mean that your child will have the migraines forever. Most teens grow out of it. Some do not, but some grow out of it. Generally, you mentioned cocodamol and paracetamol as painkillers that didn't really work. It doesn't really mean that they didn't work. It could mean that they were not that responsive to the kind of headache that he's experiencing. And it doesn't also mean that the headache is untreatable. If it just means that the medication at that time wasn't right for the kind of headache that your son was experiencing, if I may say. And Migral that you mentioned is an old medication, if I'm right, a combination of paracetamol, codeine, and an anti-nausea agent. And so, yes, it helped temporarily, which is good. And it also tells us that the headache is responsive to medications, but probably that may not be the medication that would take it away. And the fact that it returned simply means that we have to think about a better way to treat the headache. So one thing about headaches is that we have various ways of approaching headaches. Of course, there are simpler ways that I've already talked about that you can do to try to take headaches away. But for migraines, you require a preventative and a curative approach. So usually as neurologists, we'll give you medications to prevent the migraine in the first place. And when you do get the migraine, then we give you a therapeutic management. So for your son, probably he requires a preventative medication that you should discuss with his doctors. But I'm happy his blood workup is normal, and that is reassuring. At least it takes away a lot of the metabolic and effective causes to headaches that we tend to worry about. And even if the headaches respond temporarily to medication, it tells us that it's a good sign. It means that with the adequate medication, he's likely to get better. But if he develops fever, confusion, that's a red flag. If he's vomiting repeatedly and having vision changes, that's a red flag, as we've already discussed. If the headache he describes as he's having these headache episodes, he describes the headache episodes as one of the headache episodes as a worst headache of his life. That is a concerning sign. And if he's avoiding school and it's affecting his activities of daily living, that is a sign to see a neurologist to better manage his symptoms. What can I say? The next steps, I would advise you to consider a headache diary. If Andrew is online, you could post a headache diary on the chat box that you could use. And this headache diary, usually we use the headache diary to be able to tailor personalized care for patients. So a headache diary ordinarily will tell you about the headaches, what time they occur, do they occur during sleep or when you are active, how long do they occur, how on the scale of 1 to 10, how painful or intense are these headaches? What triggers these headaches? You have triggers like poor sleep, missed meals. Are you missing your meals? Are you not drinking well? Are you stressed? All these things the doctor needs to know to be able to tailor a more personalized approach to medicines. And then it could also be that the medications that he's being given are not working, and there are so many medications that he can try. The other thing too is that, as I mentioned, you have to explore preventative options. So if he's having 4 to 6 headaches per month, that is a consideration for getting a headache, a preventative approach to the headache. And And that's very important. And don't overlook a lot of the lifestyle modifications like hydration, eating well, and also limiting screen time, especially for children and teenagers, is very important because they also tend to reduce the frequency of migraines in patients. And I think you are doing the right thing. You are seeing a doctor, you are following up. And migraines are very painful, I agree. And then, but they are manageable. And as I mentioned, some teenagers grow out of these headaches. And so hopefully he grows out of it. And you are not overreacting. It's normal for a mother to be worried about the child's headache. But as I mentioned, if there are any red flags, you have to visit the hospital, but talk to your doctor about a preventative approach to his headaches. Let's move on to the next question I have on my table. So please keep a headache diary. That would be very useful to the doctor. The next question is from Phoebe and Blessing. So some of the questions are really the same. And there's a question in the chat box from Daniel. He says that what about headaches that come after taking particular medications? That is some hypertensive drugs. Yes. So there are some antihypertensive drugs that have the side effects of headaches, and you should discuss with your doctor. There are several medications that we can use to reduce high blood pressure. So if it's giving you headaches and it's disturbing your normal routine or your normal activities of daily living, see a doctor. The doctor will change that medication to other antihypertensives. It's very important. If you know it's from a particular medication, please do that. Okay, thank you, Daniel, for your question. Andrew has uploaded the headache diary. So Nonto from Zimbabwe, you can download the headache diary and then use it. Print it out and use it as you visit your doctor. It's very useful for doctors. And doctors love data. Okay, the next question I have here is from Phoebe and Blessing. It's the same question, so we'll try to answer them. So Phoebe and Blessing are saying, when is memory loss a normal part of aging, and when should it become a cause for concern? Okay, so Phoebe and Blessing, this is one of the most common and most worrying questions that people ask me. And I completely understand. Forgetting things it can be unsettling, especially when you are getting older. And we have this assumption that neurological or cognitive decline is part of aging. It's not part of aging. You can be cognitively sharp up to even the age of 99 years. You do not have to lose your cognitive reserve because you are growing old. Now, so as we get old, yes, the truth is that not all memory changes are dementia, and you should know the difference so that you don't worry yourself. So let's break it down. What are the normal age-related changes and what are the red flags? So occasionally forgetting where something is, where you put your car keys or where you put your glasses, occasionally it's not a problem. If you walk into a room and you forget why you went there occasionally, that is normal. If you talk a little, like if you take a little longer trying to remember somebody's name or a word, and it's very rare, occasionally it's normal. Sometimes when you are unduly stressed up, it's very difficult to retrieve memory from your hippocampus, and it could be just one of those things. And sometimes you have an appointment and you are trying to remember, and then maybe some minutes later or an hour later, remember. That is not a problem. That is normal. It's not dementia. Some people get distracted easily and they say, oh, am I losing myself? And is that dementia? That is not dementia. And sometimes we want to remember things and we try to write them down, and we say because we wrote them down, we have dementia. That is not dementia. So that's not losing. If it doesn't interfere with your daily living, you can still manage, and you need sometimes a little help. It's not dementia. When you should be concerned, and Phoebe and Blessing, I'm speaking to you, when you should be concerned is when these changes interfere with your daily living, how you live your life, if they affect your independence, that you require somebody to help you in your day-to-day living in terms of you remembering to shower, eat, and do certain things you want to do, that is concerning. So, for example, if you forget to do familiar things, like if you try to cook and you cooking a meal, or how you use a phone, you always use your phone, and suddenly you realize your relative or yourself, you are the person is, forgetting how to use a phone, how to make a call, and all that. That is concerning, especially when they forget how to manage um, their finances, because you need a good cognition to be able to calculate your money, to be able to remember what you had in your account, and when you remove things, you really need to be cognitively intact. So if there's a problem with it, the key word is familiar. If you have people forgetting to do familiar things, getting lost in familiar places, like their own house or their own neighborhood, they forget how to go into their bathroom or forget how to go to church. This person works at the market, is a trader, and suddenly forgets the way to go to the market. That is concerning, because they've been doing that for years. So if you suddenly cannot remember that, that is very concerning. And repeating the same question all over. If you are talking to somebody and you keep repeating the same question, you repeat the answer, the person keeps repeating the same question, that should be concerning, because you should have, the first time the question was answered, the person should have remembered it. So if the person is asking the same question, it means the person in a way is forgetting. And that is a source of concern. And then sometimes we have some of our family members putting things in strange places, like keys in the fridge, or you, instead of putting a shoe down, they put a shoe in a cupboard. Those are putting, like, when you have patients putting things in a strange place, that could be a source of concern. And then when they tend to lose track of the day, what day it is, that could be suspicious if they can't remember the day they are in. And when you take them somewhere, they can't remember you brought them there. That is really concerning. The other thing is if they lose track of what you are saying, and it's persistent. So, for example, we live in the age of a lot of screen time, so we are losing a lot of focus we need to maintain quality conversations and all that. So sometimes we talk for 10 minutes and the person loses focus. That may not be concerning. But if persistently this person keeps losing track of what you are saying, and it's not following what you are saying, and it's persistent, is affecting their daily life, that is a source of concern. And then if they start making poor judgment. So one of the important aspects of cognition is to be able to take quality decisions and respond adequately to your environment. So if the person ordinarily is not the person doesn't like food, suddenly is eating excessively, well, other things could explain it. The person is not promiscuous, suddenly is becoming promiscuous, having impulse control behaviors. That could be a source of worry. So those are concerning, and you need to decide whether, if it's persistent, then that's a problem. You need to see a doctor or a neurologist to talk about it. So if the person persist in forgetting where they go to, lose track of conversations, these are the things that are concerning. And that is an answer to Phoebe and Blessing. And so if you forget things once in a while, even my mates, people who are aged in their 40s, in their 30s, keep telling me, hey, I keep forgetting things, and I'm taking longer in learning new things. Sometimes it is our approach to learning, not necessarily that there's a problem in learning. But if you cannot learn any new thing at all, it's a source of concern. That is a source of concern. But if you take longer to learn something, it could be your approach in learning, it could be other things, and that one we could evaluate it for you. If you are a bit slower, that, if it persists, it's a source of concern. So you can keep putting your comments in, and I'll keep answering. So the main thing is that don't ignore if you have any source of worry, don't ignore the source of worry. Don't ignore the source of worry. I think it's important that you see a doctor if you are concerned, and then you keep track of the changes you see, and then see a doctor about it. And then you should rule out, sometimes forgetting things could have reversible causes. Like there are certain conditions that could make somebody forget, that treatable conditions. So a doctor will be able to test you for those treatable conditions that cause memory issues like dementia and the rest. And for all you know, there's a treatable reason why the person keeps forgetting things, and a doctor will be able to help you with that. Most people who complain about memory issues do not have memory concern. They may not likely not be dementia, poor sleep, stress, dehydration, and sometimes people go through severe chronic stress from a loss or something like that, and it changes the chemistry in their brain, and sometimes causes them to forget and go through some of these symptoms. So it's important that you have it checked out if it's persistent. Okay. Before we move on to C, let's take a break.
Akwaba Ghana, I'm Dr. Vida, a neurologist. Every day, I see the incredible power and vulnerability of the human brain. Your brain is not just part of your health, it is your health. It dictates your memory, movement, mood, your very essence. Why is it important right here and right now? Stroke is the leading cause of death and disability in Ghana. Dementia is rising, silently burdening families. Headaches, nerve pain, seizures are becoming common. Children's learning is deeply tied to brain development. Ignoring brain health is a risk to our future. That is why I'm launching Brainwaves with Dr. Vida, to show you how to protect your brain from strokes, dementias, and other threats before they strike. I'll teach you how to spot warning signs and seek early care, and replace fears, myths, and stigma with understanding and hope. Expect clear explanations grounded in evidence and my clinical experience. Your brain is Ghana's most precious resource. Subscribe now and let's build a healthier Ghana together.
So we are back, and we take the next question from C. So C says that, I'll read, my mom has memory problems and I'm her primary caregiver. What practical advice do you have for caring for someone with memory impairment while also looking after your own well-being? Thank you for asking this, and most importantly, thank you for what you are doing for your mother. So now, being a primary caregiver to somebody with memory issues can be exhausting, can be emotionally draining, and not enough people talk about what happens to caregivers. So I'm very happy for this question. Now, let me tell you something important. I said it in an earlier webinar I just had. You cannot pour from an empty cup, which is very important, and you should remember this. You cannot pour from an empty cup. So it's in as much as you are helping your relative or your mother, you are giving her support, caring for yourself is very necessary and not selfish. Now, let me tell you practical ways that can help reduce your stress as a caregiver, and then I'll talk to you directly. C, right? Yes, I'll talk to you directly. So, Usually, our challenge is that we want to do everything, but a few basic things you can do is to create a routine. Okay, people with dementia have feel safer when there's a routine. They wake up, they bath, they take medications, they eat, they rest, they sleep. When there's consistency to this routine, it reduces the anxiety they keep having, and it tends to reduce confusion that goes on in their brain. Sometimes it's important to label things and to set reminders. So if you have a medication counter, sometimes it's sort of keeps you organized so that you know what to give her and not have all the medications spread out on the table. And sometimes in trying to get her to take all the medicines, you are under undue stress. Prioritize putting medications in an organized manner so that when you give it to her, it would help her. And sometimes you can keep those post-it notes, on places in your house just to remind you of what you have to do for her or yourself. The other thing is also to keep a very safe, calm environment. Recently, I had a friend call me about the father falling and breaking a bone, and they had to take him into surgery. They were stressed for over a week, even having complications from the surgery. So the challenge here is that most times when we are in a hurry to take care of them, we are unduly stressed. We don't look at our environment. Sometimes the key thing is to look at our environment and create a safe space, not a chaotic space. Organize the house, keep the patient having, a very clean, safe environment where they are not overwhelmed. There's not much clutter, all over the place. When they get up and see all the disorder around them, they get frustrated. So keep a very clean, organized environment, free of clutter. Trip hazards, things that will let them slip, water on the floor, the tiles we've been using for our bathrooms, they are hazards. And especially for somebody with cognitive impairment, it's a danger to them. Have bars that they can grab on to move around sometimes so that they don't entirely depend on you. The other thing too is to speak clearly. Sometimes you scream at them and it frustrates them. So when you are clear, you look into their eyes, you are patient, and you speak to them clearly. They may not overreact as they usually do. And then sometimes involve them in simple tasks like very, very simple things. Don't try to get them to be who they were before. And that is really important because sometimes we get frustrated that they're able to do certain things. Oh, this person had the car had this and cannot do it. And we are frustrated and we put the frustration back on the person we are caring for. So it's very important that we do that. The other thing too is also to know when to ask for help as a caregiver. If you are unduly stressed out, if you are burnt out, as I said, you cannot pour from an empty cup. And so you should consider ways to take shifts. If you are the one caring for her and once in a week, somebody can take over for the week so that you can rest out and do other things for yourself, it's best. Sometimes you can even find a nurse, somebody to care for her at night so that you can sleep and then take over during the day and take care of her. So for yourself, this is what I have to tell you. You cannot pour from an empty cup. Know your limit. So accept that you cannot fix her memory first of all. So that's your first limit. You may not be able to make it better, but you can make her feel safe and you can make her feel comfortable. That is what you can do. And so it's important that you understand that. And then also take break, call a friend, talk to somebody, schedule time for yourself within the day when she sleeps. Maybe find some time to also rest and have your me time, a call with a friend. Find a space where there are no interruptions that you can sense that you've had a me time, and that is important. And when you are frustrated, talk to a friend. Talk to somebody who would understand. But once you feel burnt out, that is your body telling you that you are empty. You cannot help your mother. And once you are empty, you need help, you call for help. And always say yes to help. You cannot do everything by yourself. So say yes to help. And most times when we are caregivers and we are with the patients, we don't eat well, we don't drink well, we don't do everything well. And then we end up being patients to the patient. And so you should also prioritize your brain health. When you have breaks, you can exercise, eat well. If you are giving healthy foods to the patient, eat the same healthy food. Don't give the patient good food and then eat junk food. As a caregiver, you are harming yourself. And so it's very important that you take good care of yourself. Okay, so see, I hope I've answered your question. And then also remember that one, you are a child, you are also your own person. So it's very important to own your life. So if there are parts of your life that you've neglected and people can help with the care so that you can take over that life, I will advise you to also consider that. You are doing something nice for your mother, and it is okay to admit when you are frustrated and when you are stressed up. And this is an appreciation to all caregivers. Today is World Brain Day, so a very big shout out to all people who are caring for people with neurological conditions. Thank you very much for what you do. So the next question, let me take the next question. So our next question is from Sarah and Kofi. Sarah and Kofi are saying that what are the warning signs of a stroke? And how can I quickly recognize if someone is having one? Very, very important question, because stroke is the number one cause of death and disability in Ghana. And so it's a very important question to me. When someone has a stroke, we always say time is brain, because every second is important to the brain. If the brain loses blood supply, so what happens during stroke? So when you talk about stroke, you have blood vessels like pipes through which blood flows to supply our brain, for our brain to work effectively. You need your brain to be able to think, move, dance, do everything. So when these blood supply to these parts of the brain that control these functions is lost, that is when we say you have a stroke, because that part will not have blood supply for you to work. Now, when it comes to stroke, there are two types. Either the tubes have a blockage, which we call it the ischemic stroke, or the vessels or the pipes, they tear. And then when they get torn, the blood pools in one location. And the end result is that same blood that's supposed to move through the pipe and go, it's pulling at a different location, and it's not going to the place for which you need it to. And so it's very, very important that we address stroke. Now, every minute without treatment is a danger. When the person is able to come to the hospital within the first 4.5 hours, there's a possibility or likelihood of treatment that can be given to the person to dissolve the clot, especially if it is an ischemic stroke or there's a clot blocking the vessel. So time is brain. Now, every minute without treatment means billions of cells will die off. So the faster you act, the better the chances of recovery for whoever is experiencing the symptoms. Now, to your question, how do you tell if somebody has a stroke? We use an acronym, FAST, FAST. FAST, FAST. So F is you ask the person to smile. If one side of their face droops or drops, you see that once they smile and one part is flat or drooping, it could be, and it's sudden. This stroke happens suddenly. It could be a stroke. If you ask the person to raise both arms and one arm drifts downwards, it means that side could be weak. So that is the A. And the S is you ask them to repeat a simple sentence. If they are fumbling with it and they are saying strange things with it, or they are slurring, like that kind of speech, that is slurred speech. So that is a warning. And then the T is time. The T is time. Time is brain. So if you see any of these changes, immediately bring the person to the hospital or call for emergency services, call for help, call somebody to help you move the person to the hospital. So that is the fast. So if you see any of these signs, don't wait and say, oh, let's see, maybe he's not feeling well, he'll sleep it off. Maybe another time we'll call for help immediately. So the fast is a very good way of picking up most strokes. But the other thing I'll say is that if the person complains of sudden numbness on the face, hand and leg on one side of the body, it could be a stroke. If the person is well and suddenly has this confusion and cannot understand speech or is saying gibberish, is not responding adequately to you, and it's sudden, it could be a stroke. If they have trouble walking and you see that they are a bit weak on one side, that could be a stroke. And sometimes, as I mentioned earlier, those severe kinds of headache, it could be a thunderclap headache, it could be a stroke, a form of stroke in the brain. So very severe headache that comes with confusion, vision changes and all that. That could be a stroke. So you call for help immediately. And when you call for people to help you or you decide to send the person to the hospital, you look at the time, because when you get to the hospital, the doctor will ask you, when did you notice the sign? Because we use the time, the duration, to be able to decide whether dissolving the clot is an option for the patient. Sometimes we see somebody who we believe is having a stroke and we give them food or we give them aspirin. Don't give them anything. Sometimes when we try to feed them, they might have lost their ability to swallow, and then we make them aspirate and it worsens their condition. So don't put anything in their mouth. And the main thing is to you be calm and ensure that the patient is comfortable and safe. Most people will say, oh, today is a bad headache day, and this will pass, I'll be fine, I just need to rest it off. No, when you see the first symptoms, face drooping, arm is weak, you see that the speech is slurred, burning sensation, suddenly weakness, numbness on one side of the body, you do not wait. Who are those at risk of getting this? People with high blood pressure, which is a very big risk factor. So please, if you've not checked your BP this whole year, please find a hospital or a clinic or a pharmacy and check your BP. It's important you know your numbers. You know your BP. Your blood pressure should not go above the top part that is checked. We have the systolic and the diastolic. The top part is your systolic. It shows you when the heart is beating, the pressure. And the pressure when your heart feels is the diastolic. So the top part should not go above 129. So if it goes above 129, you are heading towards its hypertension, and the lower one shouldn't go above 85, 89. So if they check and it's going up, please see a doctor and let us help manage your blood pressure. Know your numbers. Hypertension is the single biggest risk factor, and most people do not check. When your BP is high, you may not have symptoms. So it is not about waiting for symptoms. Even people come with strokes, and that's the first time they realize they even had high blood pressure, and they've had it for a while, but because they never check it. So please check your BP. Diabetes is also a very big cause of strokes. So you should know your numbers. You have to check your fasting blood sugar, and we have a test we call the glycated hemoglobin, or the HbA1c. Now, the fasting blood sugar will check your sugar at this time in the morning when you fasted, but the glycated hemoglobin test will test how your body has processed sugar over 3 months. So it's a good measure of whether you have a problem with your managing your blood sugar or you are at risk of diabetes. So it's important you don't just do the fasting blood sugar, you do the glycated hemoglobin. And for high blood pressure and diabetes, I have videos on this YouTube channel that Andrew can post, and then you can watch it later. High cholesterol. So when you go for your yearly checkup, you should check your cholesterol levels, because when they are high, they cause these pipes I mentioned earlier that cause stroke to be hardened. And when they are hardened, blood finds it difficult to move through it, and then you're at risk of stroke. Smoking too, that's the same thing. So if you smoke, please stop smoking. And then if you have any heart disease, and generally the risk factor for stroke is aging. So older people are at risk of stroke, and people with a family history of high blood pressure, diabetes, and strokes are at risk. But doesn't mean that when you have a family history, you automatically get it. That is why we are talking about preventative brain health. So if you know you have a family history, you check your blood pressure, you make sure you are checking your all these things I've spoken about, you'll be able to take control of that. And so if you know anybody with this risk factor, please advise a person. And as you've learned today about fast, please share this information to anybody you know so that you are not the only person with this knowledge. You are sharing this knowledge abroad, because stroke is not something we can hope away. You cannot hope away stroke. Stroke is a medical emergency. So if you have a relative with a high blood pressure, please let them check consistently and regularly. And if they are on medications, please take your medications. The men, please take your medications. Men have a lot of 1,001 reasons why they don't take the medicines. Please take your medications. And if you feel that a medication is affecting you negatively, work with your doctor. We always have options and we can change it. So share this knowledge. I hope I've answered you. Let's go to the next question we have from Heather and Vivian. I think Heather and Vivian have the same question. So Heather is saying that what are the most important things I can do every day to keep my brain healthy? So Vivian added that she's looking for simple, practical habits that she can follow for her brain health. Okay, so I would keep it concise. 1, sleep. Sleep for 7 to 9 hours. And sometimes it's not just about the number of hours you sleep, but the quality of the sleep you have. So why this is important is because when we sleep, your brain has a system that is known as your glymphatic system. So this glymphatic system uses your deep sleep. There are stages of sleep, but it's the deep sleep that the glymphatic system uses to clean out all the mental clutter you've had throughout the day. So imagine that you are in a room and then people are delivering parcels into the room, putting it here and there. At the end of the day, you have to pack and sort them out. That's what the glymphatic system does. At the end of the day, it cleans out all the toxins and the bad things that have come into your brain throughout the day and sorts out your memory and things that have to be sorted. So it's very important that you allow your body to go through a deep sleep. So you may sleep for 7 to 9 hours, but if it's not quality sleep and you didn't have deep sleep, your glymphatic system will not be doing that. So we need quality sleep. How do you get quality sleep? Sleep for 7 to 9 hours. Have a consistent way of sleeping, time of sleeping. Your brain thrives on consistency. So have a consistent time of sleeping. Don't limit screens. Don't have screens in your bedroom or watch your phone till you sleep. You see, the phone and the TVs have a blue light, and this blue light keeps your brain active. But if you change your phone screen to the gray mode, or you even put your screens away, you allow your brain to secrete the sleep hormone, which is melatonin. Okay, so when you put your phones away and you keep your room dark and cool, you can sleep. Some people's rooms are so cluttered and hot. That's why they cannot sleep. And that's why they are not having good quality sleep. Please ensure that your room has limited clutter and it is dark and cool so that it can stimulate your the body's melatonin so that you can sleep. So I'm advocating for no screens in the bedroom. Okay, the next thing is to drink water first. Sometimes we wake up and the first thing we do is to check our phones. Before you check your phone, drink a glass of water because your brain thrives on water. And so if you don't drink enough water, your brain could be fatigued. And some people complain of this mental fatigue by 12 o'clock, and it's because they are not drinking enough water. So drink water. And people enjoy coffee and tea. Before you drink the coffee and tea, please drink a glass of water for your brain. And then exercise. Heather and Vivian, exercise is the single most important thing you can do for your brain to prevent brain diseases and to also help restore brain function when you have a problem with your brain. And exercise doesn't only mean going to the gym. Walking around in your house, brisk walking around your house, 30 minutes, 5 times a week or 4 times a week. You can dance in your room, walk around. Some of us, instead of dropping at the last stop, drop at 2 stops before your shop, your office or shop, and walk. Do something, move your body. And what happens is that when we move, we have a chemical or protein that's released in our brain called the BDNF, and it helps to protect and maintain your memory. And dopamine from exercise lifts your mood and puts you in a happy mood. So you are starting the day on a good note if you start off with some form of movement or exercise in the morning. So Vivian, exercise, very important. It improves blood flow to your brain. And then you have to eat brain healthy foods. So usually I don't like to give a brain prescription, but talk about the things that make your food healthy. We have a lot of brain important foods that are good for our brains. Our vegetables, the contomere, we have all our lettuce, the garden eggs. We have good food. Please add vegetables to your diet. Some of us, so the science is that on a plate, half of your plate should have vegetables, half should have, a quarter should have protein, and a quarter should have carbohydrates. But most of us, we have a very big bowl of fufu, one meat, small soup. That is not balanced. So you can still have your tea or your oats in a moderate amount, 2 slices of bread, some lettuce or some vegetables, and you are good to go. Have a protein-dense breakfast. What happens is that proteins tend to take a long time to break down. So they kind of give you a consistent flow in terms of what you are eating. It gives you consistent energy. When you start off the day with sugary foods, your body absorbs the sugar fast, and then you are hungry again. So protein dense meals, especially in the morning, is very, very important. And also how we handle stress for your brain health. I was just talking about stress in the other webinar we just had. Stress acutely is good for your brain, especially when you are being attacked, or you realize you are going to fall into a gutter. God created our bodies to respond acutely to stress like that by increasing blood supply to your muscles so that you move quickly from where you are in danger to where you'll be safe. You have deadlines, acute stress, your body is able to handle it. But when it's chronic, like a car alarm, and it's always on, it increases the size of your amygdala, which is your brain's alarm system. And so it means that the alarm is triggered so much that even little things that shouldn't stress you will now start stressing you. Somebody says something that shouldn't trigger you, then you have an exaggerated response to that stress. Or somebody says something and then you exaggerate in terms of your response. Stress affects your prefrontal cortex, so your decision making, it affects it. It affects your hippocampus, which stores and retains your memory and helps you retrieve the memory. So when you want to remember things, you have to store it, and when you want to have it, you have to go back for it. What stress does is it shrinks the hippocampus. So if it's shrinking your hippocampus, you find it difficult to remember things. And our students will tell us, when we are preparing for exams and you learn to the 3 a.m. and your exams is 8 a.m. and you don't sleep well, your brain doesn't get to consolidate all that you have learned. So when you wake up and you want to remember what you have learned, that's when your brain will smile and your glymphatic system will say, hey, I don't know anything about this because you didn't give me the time to consolidate that information. So it's very, very important that we work on chronic stress. And one of the ways to limit chronic stress is learning simple things like breathing exercises, taking a deep breath, holding it for four counts, and then releasing through your nose and releasing it through your mouth. Those 3 minutes breath exercises sometimes calms you down and helps reduce the stress hormone, which is cortisol, that is released. And then the other thing too is to understand that connection is medicine. Some of us, we've isolated ourselves from friends and family, and isolation is one of the main cause of cognitive decline and dementia. A very important cause. So let's learn to understand family. Scrolling on social media and going over TikTok is not social connection. Call a friend, call your relatives. Some of us will not call their relatives, an uncle, your neighbor. You've been living in a community, you're not even talking to your neighbor. And so your neighbor, is important that you once in a while get out, talk to your neighbor, bond with people. It improves a lot of um, things in your brain, and then improves connections in your brain and limits your ability to develop dementia or cognitive decline. So connect with somebody today. Call somebody, a friend you've been meaning to call. Call the person today just to check in. And then the other thing for your brain health is to check your blood pressures, do all these yearly checks where you check your blood sugar and high blood pressure and cholesterol. They are important. At least for blood pressure, you should check every month. You should know your numbers. And then one of the excellent ways to improve your brain and to keep your brain sharp till you are old is to learn something new every day. Learn a new craft, learn how to play piano, travel and see somewhere new. Your brain thrives on new things. It always forms new and better connections when normal routine makes your brain in a way lazy. But when you try new things, you learn new things, you'll be building new pathways and connection that improve the way your brain works. So sometimes it's just about learning a new recipe, learning a new word, learning a new language, maybe trying to find a different route to your workplace. Maybe you use this route. There's another route. Just try, just to give your brain that experience of something new. Okay. Good. So I hope I've answered your question. Let's move on to the next question and let me check. The next question is from Injidi from Nigeria. So Injidi says, what foods are best for brain health? And are there nutritious foods that support brain health locally? Okay, so Injidi, you're asking this question from Nigeria, so I'll try and answer the question from both Nigeria and Ghana. So food is very important. I've already talked about some of the foods that we have to eat. Here I want to also talk about fruits consumption, which has been linked to better brain health in terms of memory, recall, and generally your mental health. So leafy greens like our kontomire, I don't know the ones you have in Nigeria, but similar to that, is very good. And fermented food that we have, and fermented fiber, and all our foods that are high in fiber are good for our brain, because there's a lot of challenges we experience in our brain that ultimately affect our brain health. There's a huge connection between our gut and our brain, which is important in our cognition or how we remember things and our memory. So fruits are very, very important and are of massive benefit. So we have baobab fruit, and the baobab tree is a very important tree in Ghana. We don't have an appreciation of the benefits. So we have the baobab fruit powder, the leaf powder. The fruit powder is edible, is put in cereals, is very good. It has a lot of antioxidants that enhance brain health. We have bananas, we have pineapples, we have mangoes that give steady energy to our brain without giving us that rush of sugar that is not good for our brain. I know in Nigeria, I don't know if I'm mentioning the word well, but you have pumpkin leaves. It's called yugu. You can correct me if you are here and you are listening. They are called pumpkin leaves, and they are very high in folate and lutein, which is very good for your brain. So they are bitter leaf, water leaf. They are used in soups and stews, and they are also very, very good. So you can add them to your stews and soup a couple of times a week, and they are good for all of us. So the brain is over 60% fat. So you need healthy fats to maintain the brain cells and enhance memory. So mackerels are very good in omega-3, and they are quite affordable. Sardines are that. So we encourage you to take fish at least 2 to 3 times a week. And also we talk about nuts. So we have granuts, a lot of granuts, and melon seeds, the gushi, which we use in our soups, and they are very high in healthy or rich in healthy fats. So it's very good that we encourage eating of that. And sometimes when you are hungry and you want to take a snack, we have our cashew nuts, we have granules. Why not take some nuts instead of taking biscuits, which may give you a rush of sugar in your body? And then our fermented foods. So we have the millet, we have various foods we make with millet, maize, sorghum. I know there's this ogi that Nigerians also do that has a lot of probiotics, which is good for the gut. So Njide, if you are here, I'll advise you. And then our own gari is high in fiber. We have a lot of magnesium, and that fiber aids in digestion and support brain health. So it's also one of the options we can also use. Potatoes are healthy starch that we can use. And then for healthy fats, so there's been a lot of concerns about what fats to cook with. We already have our palm oil and all that. Those are healthier oils than the seed oils that we have. The seed oils, we have the canola, sunflower, and all those ones. I don't want to promote anybody's drug, but we have our palm oil. So we should use the palm oil too in moderation and use it more to cook. Okay, I hope I've helped you in GD. Let's move to the next question. The next question is from Nyaku. So Nyaku says, how does chronic stress affect the brain and what are the healthy ways to reduce stress and release tension? I think we've already talked about stress in another, so we can skip, but more of the fact that memory problems, cortisol will shrink your hippocampus, which helps you to learn and have memory and all that. Stress can cause a lot of exhaustion and sometimes even headaches and muscle tension. So it's important that you reverse this. And the brain is adaptable. When you change or reduce the stress that you have on your brain, the amygdala that's increased will regress, the hippocampus will stop shrinking. So there are preventative ways we've already talked about, the breathing exercises, moving your body in exercise and talking to somebody. Sometimes what is stressing you, when you write it down and you write out all your problems and you choose which one you can handle as at that time, it helps you handle the stress better. And then you cut down on certain stimulants. So sometimes you are just triggered off because you are on caffeine, nicotine and caffeine. And when you reduce those stimulants, you are better placed to handle the stress that you are going through. And then laugh. The Bible even says laughter is medicine. So have a good laugh. If you like comedy, watch comedies. And sometimes those things take your mind away from all the stress you're experiencing. And sleep, I've already spoken about sleep. The concept of sleep is to have quality sleep and not just the duration. So quality sleep, no screen time before bed, and keep your room cool and dark. It helps your body to secrete the melatonin you need to naturally be able to sleep. And then you should also understand that over time, that chronic stress and then poor sleep, people now will develop hypertension and all sorts of conditions because they are not sleeping well. So they wake up and they are tired, and over time they develop hypertension and all that. So it's important that you manage stress well. We cannot run away from stress, but we can find ways to properly handle how we manage the stress, okay, how we respond to the stress. Okay, so the next question, and if you have any more questions, you can put in the chat box. You can give us a hi so that I know you are still listening to me, and you can put your reaction there so that I know that I am talking to an audience that is interested. So the next question is from Daniel. Daniel is asking, does snoring affect brain health? If so, when should it become a medical concern? Now, snoring is common, but snoring that is linked to sleep apnea, which I'm going to talk about, can affect your brain health over time. So when you snore and you have sleep apnea, what happens is that when people with sleep apnea sleep, they wake up with episodes of, so the apnea is not breathing. So whilst they are asleep, they wake up several times and they cannot breathe. They have to get up and gasp for air, catch some oxygen to be able to sleep. And what happens is that this apneic episodes, or these episodes where they are not able to breathe properly, reduces oxygen to the brain. So, and this oxygen that it's reduced to the brain, these sleep pulses will stop these oxygen levels and harm your brain, harm the brain tissue. And sometimes, as I mentioned, whilst you sleep, that is when the glymphatic system and your brain is trying to order your memory and all that. And these apneic episodes will disrupt your memory storage. So you have somebody sleeping and the sleep is fragmented because they keep waking up catching them. So people with sleep disordered breathing are more likely to have changes in their brain and more likely to have cognitive decline over time. Okay. And research has shown that especially people with sleep apnea in their midlife tend to develop cognitive decline early. So when would snoring become a medical concern? So if it's you or your partner, but most likely it's your partner that will tell you that it's a problem or a medical concern. The first thing is if the person gasps or pause in breathing, the person is asleep, then suddenly stops breathing. And usually it's a partner who will notice that the person is not breathing and then starts breathing again. That is a problem. If the person has very loud snoring and is constant loud snoring, that is a medical concern. If the person wakes up with a morning headache, every morning they don't sleep well, they wake up with a headache, that means there's a problem with their sleep. They are likely snoring, having sleep fragmentation, and they are not sleeping. And then if the person wakes up and then sleeps throughout the day, so excessive daytime sleeping, it means the person didn't sleep well, is likely having fragmented sleep from apneic attacks, and the attacks are more frequent than normal. And patients or the person is experiencing this disordered breathing, and that is a source of concern. And the striking thing patients always say is that they wake up and they don't feel refreshed. You are supposed to feel refreshed because when you sleep and you have deep sleep, which is usually disordered by the apneic episodes, that deep sleep is disordered. So they wake up, they are not refreshed, it's almost like they didn't sleep. That is a source of concern. And then most people develop hypertension from that, the sleep disordered breathing, and they wake up with like palpitations or a racing heart. That is a source of concern. And usually, before you see a doctor, if you have your BMI is above 30, or you have an excessive weight, you need to consider weight loss. Quit taking alcohol, which is a toxin and affects your brain. And some people take alcohol just before bed. It's a bad habit. And then you probably sleeping on your side as opposed to sleeping on your belly would help reduce the snoring. Okay, so we'll take a second break and then I'll continue with the questions.
You're doing good.
The right local foods doesn't just fill your child's tummy, it builds their brain, boosting learning, memory, and mood. Today on Brainwaves, we are serving up the best nutrition for your child's brain to thrive. First up, healthy fats. Your child's brain is nearly 60% fat, and it needs the right kind of fat to build strong brain cells. Avocado pear, nuts and seeds, fatty fish like mackerel or salmon, eggs. These foods are rich in good fats, which are essential for focus, memory, and brain development. Next are the brain spark plug, iron, zinc, and choline. Iron from kontomire carries oxygen to the brain. Zinc from beans supports memory, and choline in eggs helps with learning. A lack of these can slow down brain power. For steady energy and protection, turn to complex carbohydrates and colorful vegetables and fruits. Foods like maize and sweet potatoes provide lasting energy, while fruits protect the brain cells and support a healthy mood without the crash from sugary snacks. You don't need a perfect diet, just progress. Try these easy tips. Add groundnut paste to soups and porridges. Swap sugary drinks for sobolo or water. Serve kontomire or other leafy greens regularly. And use palm fruit oil in cooking for healthy fats. Every healthy meal.
Right, we are back. So I have two more questions, and then we'll reserve the other questions for another live session as we are taking a bit long. The next question is from Seidu. I think the question is about child. I have to pick these two questions about child development, and we can do the other questions on another day at another live. All right, so Harry sent this question, and Harry says that what measures can be put in place to get your child who is on the autism spectrum brain function like any other child? So he's asking how you can get a child who is on the autism spectrum brain to function like any other child. Now, thank you for this question, Harry. It's a very common question parents have. My answer shortly is that it's not about making the child's brain function like a typical child. It's more about giving your child a unique experience and the right set of tools to grow and build better neural pathways to be his own self and to have a more personalized approach in terms of his care. Now, what happens with people or children on autism spectrum is a spectrum. So people have mild symptoms they have challenges with social connections and in communication and in certain behaviors. That's what we see in people with autism. So for your question, every child is different, and the idea is not to try and change your child. The idea is to meet the child where they are. What challenges your child have, meet them where they are and help them flourish with what the brain that they have, and not to make them like a typical child. I don't think we have typical children anyway. But the most important thing that you have to understand that our brain is adaptable. Our brain is plastic. And so it's adaptable, and there are so many things that we can do to help a child, and especially in the early stages. So the brain is more flexible to and adaptable to change in the first years of a child's life. And so early childhood early intervention is the best time to intervene in terms of helping a child in the autism spectrum. So we have parent-led interventions, and we have interventions that need to be done by a neurodevelopmental specialist or a specialist who has been trained to understand such children. But so the most important thing is if you have a child on the spectrum, you seek professional help. The professional person, like a neurodevelopmental specialist, will do a formal assessment and tailor the treatment particularly to your child, a personalized treatment for your child. And is more about connecting with your child than about fixing your child. So you don't need to change the child's brain necessarily, but you give the child the right experience in terms of these parent-led interventions and these formal-led interventions by specialists, and I think the child will function best. But let me just give a few heads up about what parents can do, parent-led interventions. The first thing is to follow their lead. So if, for example, you have a child on the spectrum and he starts, especially during play, lining up cars, you also go and help him line the cars up. If he's spinning a wheel, you also go and spin a wheel with the child. It's not about saying, don't do this, don't do that, but actually trying to build connection, going into their world and building that connection with the child so that the child builds trust with you and the child can trust you and the child can learn from you. Okay. And there's what I always talk about in our videos about serve and return. That's how we train children. So a child would make a sound or a gesture or look at you in a certain way, and you have to respond appropriately. And so the child serves you with a gesture or something like that, and you respond appropriately. That back and forth intervention is what we call the serve and return interaction. So you give your child the chance to do something like, for example, babble. If they can't talk, they are babbling, you also babble back. It's a return. And it's a way that, or if they point at something, you also point at that. They say something, you also say it. It's called the serve and return interaction. And that, when you help them with silence to serve, and you return, it's a very good way in which their brain forms excellent neural connections. And also using simple language when you are dealing with your child. It's very simple. Let's eat. When they are bathing, maybe when they are eating milk, up means get up. Very, very simple words. Let's eat. Up, down, sit. Very simple, basic English. And give them time to process what you are saying. It's very important. And that's why I said these parent-led interventions are very key. So, for example, I'm washing my hands. You tell them that you are washing your hands. Here is the cup. You say it, even if they cannot voice out. You are teaching them, but you are leading it. Here is a cup. Something like that. And also create a visual. They like, most children on the spectrum like consistent routine. So they work best on routines. They sleep, they wake up, they eat, they play, they sleep. You should build a certain consistency in the routine for your child and ensure that in as much as you are trying to get the child to play, you 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 understand that the child is not like every other child. So enjoy what they enjoy and try and play. If they love puzzles, do puzzles with them. If they like playing ball and they are doing repetitive things with the ball, you keep doing that same repetitive things with them. It builds trust with them. And make sure that every routine you are doing in a day, you are trying to use them as a way for the child to learn. Wash hands. So the child over time will know that when you do action, it means wash hands, the child will wash. Or splash water when they are bathing. You tell them just splash the water. Those cues when they eat or they are sleeping is very important for children on the spectrum. And then can we take a last question? There are lots of questions from Togo. Okay, there's a question from Kofi about how is patchy. So that's our last question, and then we are good to go. How is patchy numbness associated with the brain? So people complain that they have numbness in the leg. And how is it related to brain health? So that's a good question, but most people think it's a problem of the foot. It's not a problem with your foot. Usually your brain has a lot of conversations. It does every second is communicating with your brain. It's telling your brain where your leg is, your joints are, what is in your surroundings, sending signals up into your brain, the temperatures around so that you don't step on hot things. There are a lot of information your foot gives to your brain. And when you start feeling this numbness, it usually means there's a problem with the nerves carrying those messages to your brain. So it could be that those nerves themselves are damaged, what we call peripheral neuropathy. So those nerves are outside your brain or your spinal cord, but they move into your muscles in your foot or your leg. And if they are damaged by things like diabetes, the small vessels or pipes that feed these nerves, diabetes damages these small pipes or blood vessels. And sometimes when they don't, the messages from these nerves become patchy, and that's what your brain interprets and tells you that they are patchy. And other times too, it has to do with actually simple things like crossing your leg for too long or sitting for too long. You need to stretch out your leg. You can feel some temporary numbness. And then sometimes too, the problem is in your back or your neck. So if you have a herniated disc, those discs are in between your spines, and if they are herniated, they can touch on a nerve and impair the messages that the nerve gives to the brain. So it's a two-way street. Your brain will interpret all the signals it gets from your foot, and then if those signals are missed or interrupted, your brain will interpret it as patchy. So it's important you report to a hospital and evaluation is done. So thank you so much for joining me today. I have about 10 more questions. I'll figure out when to do those questions within this month or next month. But thank you so much for joining me for this World Brain Day live. And I hope you've learned a thing or two. And we'll keep the live on our YouTube channel so you can share it with people so that the brain access the World Brain Day theme is access to all. So we all have access to brain health information. Thank you and see you.
Somehow so the light one, like one lower.
Aqua Bagana,
So it's
I'm
a
Dr.
useless
Vida,
light.
a neurologist.
Mhm.
Every
Didn't
day
shout
I
that.
see the incredible power and vulnerability of the human brain.